I'm Pradeep Besak. I'm the Asia Coordinator of Global Call to Action Against Poverty GCAP. Before I give a brief introduction to the event, let me invite Johannes, our communication colleague, to share with you how you can avail the interpretation facilities we have and how you can intervene from the floor. Johannes, can you explain that?
Yes, of course. Thank you very much, Pradeep. And good morning, good afternoon, good evening to everyone. I'm also part of the Global Secretariat of GCAP. Just some technical announcements here. We do have interpretation for this event in Hindi, French, and Spanish. To access the interpretation, you need to select on the bottom right a little language icon that says interpretation. And there you can select English or the corresponding language that you would like to listen to. I will now say the very same thing in French and Spanish, just to make sure that everyone who does not speak English also receives these instructions for interpretation. Entonces, muy buenos días a todos y todas. Quisiera brevemente explicar que tenemos disponible interpretación durante este evento. Ustedes pueden elegir a la derecha, abajo, hay una bolita pequeña que dice interpretación. Ahí pueden escoger su lengua preferida, en este caso español. Si tienen alguna duda, pueden también escribirme por el chat si tienen algunas dificultades técnicas. Y ahora voy a decir lo mismo en francés y después podemos arrancar con el evento. Muchas gracias. Bonjour à tous et toutes. J'aimerais bien expliquer brièvement la fonction de l'interprétation qu'on a disponible aujourd'hui. Vous pouvez choisir en droite, en bas, il y a une petite boule qui dit interprétation. Là, vous pouvez choisir français pour écouter tout l'événement en français. Si vous avez des difficultés, vous me pouvez écrire dans le chat aussi. Oui, ça c'est tout. Maintenant, on va écouter une dernière fois l'explication en hindi. Please go ahead with the Hindi explanation, Pradeep, and then I think we can get started.
So, दोस्तों, हमारे साथी जो इंडिया से हैं और साउथ एशिया से हैं, जिनको हिंदी समझ में आती है, हमारी हिंदी इंटरप्रिटेशन अवेलेबल है. आप जो राइट बटन है सबसे, वहाँ इंटरप्रिटेशन करके एक ग्लोब सा है, वहाँ से जाके आप अगर हिंदी क्लिक करेंगे तो सारी भाषाएं आपको हिंदी में ट्रांसलेट होके सुनेगा. होप दैट्स ऑल राइट. और आपको अगर कोई सवाल पूछना है, आप ये वेबिनार फॉर्मेट है, इसमें बस स्पीकर और मॉडरेटर इनकी चेहरा दिखेगी. आपको अगर कुछ सवाल पूछना है, आप रेज हैंड करके एक हाथ उठाने वाला है नीचे, उसको आप दबाएंगे तो जो टेक्निकल मैनेज कर रहे हैं वो आपको स्पेस देंगे ताकि आप अनम्यूट करके अपने आप को बोल सकते हैं. अदरवाइज नहीं बोल सकते. तो आपको अगर कुछ बोलना हो, पार्टिसिपेंट है, स्पीकर नहीं है, तो आपको हाथ उठाना पड़ेगा. So thank you, Johannes. Yeah.
There's one more thing that I forgot to say. Apologies for that. Sure. If you wish to make an intervention from the floor and ask a question at the end of the event, if there's time, we would encourage you to raise your hand when the moderator indicates you to do so. And then you will be able to speak in the main event at the end to ask a question or make a comment. We would generally also very much encourage you to use the chat function to ask questions, and they will be then collected and looked at by the moderator and also then the participants ultimately. That's all from me, and thank you very much. Let's have a great event.
Okay, thank you. Thank you, Johannes. So let me give a very short introduction to the event. It's evident that most marginalized communities are doubly suffering during the COVID pandemic, one from the disease and the other from poverty, hunger and inequality. While the women in general are facing challenges like loss of jobs in informal sector, increased domestic violence, rising poverty and hunger, the difficulties of women facing multiple discrimination are inexplicable. Women from indigenous communities, discrimination based on work and descent, DWD communities, women with disabilities, old women, women refugees, so on. And these are the communities who are going through very high deal of ordeal, which needs central attention by the policymakers when the discussion on safe recovery is applauded. The need for proactive social protection from the government in order to achieve key sustainable development goals. The side event will discuss the impact of the pandemic on these groups of women. highlighting the intersectionality of gender identity and community identities, and deliberate the ways to build forward better. We are in fact happy to have a very eminent panelist. Today, we have two eminent personalities, a chief guest and keynote speaker. That is something which Leonard as a moderator will do. But before I hand it over to Leonard, let me state the names of the organizers of the events. GCAP, Awaz Foundation, Pakistan, Asia Indigenous Peoples Pact, a network of indigenous women in Asia, Asia Dalit Rights Forum, Global Forum for Communities Discriminated on Work and Decent, Latin Dad, GCAP Zimbabwe, GCAP Sierra Leone, Japan's CSO Network for Global Health, SDGs Japan, HANA Federation of Disability Organization, AMAS BIF Mali, and Polycom Kenya. Thanks all of you for joining. I now invite Leonard Mandishara, Executive Director of NANGO, which is GCAP Zimbabwe, to moderate the event. NANGO is the umbrella body of NGOs operating in Zimbabwe, having a membership of more than 1,200 members across the country. Over to you, Leonard.
Thank you so much, Pradeep, and good morning, good afternoon, good evening, colleagues. We have managed to join today's panel discussion. We want to thank you so much for finding time to join from the respective, institutions and countries that you are coming from. And today we are going to be having key discussions on the topic, Leave No Women Behind, during the COVID-19 pandemic. Like what Pradeep said, today we are joined by eminent speakers who are going to assist us to then have a critical discussions around the issues that we are going to be having today. So in the interest of time, let us at this point in time invite the chief guest who is going to be speaking on the experiences of Zimbabwe. So we have Dr. Edmos Mtetwa. Dr. Edmos Mtetwa is the Chief Director in the Ministry of Public Service, Labor and Social Welfare in Zimbabwe. And in his capacity as the Chief Director, he oversees all matters to do with social protection, including social protection within a social development context. In addition, Dr. Mtetwa oversees all child welfare policies and programs in Zimbabwe, together with other welfare issues, such as issues to do with the refugees and older persons, amongst other groups. So Dr. Mtetwa also oversees the disability issues under the Department of Disability Affairs, working with his team of directors. He is therefore instrumental in Zimbabwe's national social policy area. So allow me, ladies and gentlemen, to call upon our chief guest, Dr. Edmos Mtetwa, to address us today in this panel discussion. And we are going to be giving him about 12 to 15 minutes to deliver his presentation today. I invite you, Dr. Mtetwa, to make your submission. Thank you.
Thank you. Thank you very much, ladies and gentlemen. My apologies for probably poor connectivity in this side. I'm happy once more, to join, this global discussion.
Alert, the host has spotlighted your video for everyone.
It is very important indeed to, discuss these issues, particularly as they impact, vulnerable groups in society. I know, COVID-19 has had, devastating consequences, on both the lives and livelihoods, of people the world over, and Zimbabwe is no way exception. Being a third world country, we, together with the other countries, are also putting in place, coping mechanisms, including safety nets, to ensure that our people are cushioned against the deleterious effects of containment measures that we put in place in order to avert the catastrophic consequences of the pandemic. So COVID is, and will
Dr. Edwards,
continue
sorry,
to
sorry to interrupt. Sorry. Can you bring your
yes,
camera a little? We can just
pardon?
see above your eyes. We cannot see
Can you
you.
hear me?
Yes, we can hear you, Doc. There was a request that are you able just to bring your I think your camera maybe a bit from you so
You
that
can't?
yeah, we can hear you, but they want also to see
Can you hear me?
Yes. Yes.
Can you all hear me?
Yes, Doc, we can hear you, but there was a request that maybe if you can move a bit, maybe your gadget so that people will be able to see you as you make your interventions.
Okay, thank you. This is okay, thank you. So
Alert, Mr. Khalifa Salah.
this made the situation any better?
Yes, it's now better. Thank you. You can proceed.
I think this is the best view that I have. Okay, thank you. So I was saying COVID-19 has and continues to, affect everybody, in Zimbabwe, and everywhere else, regardless of social status, gender, age, level of education, however, the impact of varies across, and according to social demographics such as, socioeconomic status, income, and gender. Women are particularly, more vulnerable, because of, their less privileged position, in society, and over and above the burden of care, work associated with, gender in, a patriarchal environment. But, government through, the Ministry of Public Service, Labor, and Social Welfare, has not, folded hands, and watched, the pandemic ravaging
Alert, your internet connection is unstable.
lives. But our government has stepped up, with a number of social interventions, to ease that impact. And I regret probably the time allocated may not suffice, but may I bring attention of all of you to the fact that our interventions are couched within the confines of what we commonly refer here to as the National, Social Protection Policy Framework for Zimbabwe. Those of you that are in Zimbabwe may know, the impact of COVID-19 goes well, beyond the health faculty, of individuals, to even devastating the socioeconomic, and psychological, spheres of lives. And so our ministry, from March 2020 to date, has been employing, its social protection policy instruments to guide social interventions targeted towards, mitigating the impact of COVID-19, in line with, our social risk management, approaches that we have. And the chief policy instrument, like I said, for our intervention is our national, social protection policy framework, of 2016. And this gives, us an implementing infrastructure with 5 pillars. But the overall goal of the national, social protection, policy, framework is simply to reduce, social vulnerability that is likely to result from both, idiosyncratic, and the covariant, risks. So it is also anchored upon, the need to eradicate poverty, among the vulnerable groups, in our society, in keeping with them, the UN, development agenda, SDG, particularly SDG 1, among others. So our pillar is the first among our pillars is that of social assistance, which is a fundamental pillar under the COVID-19 intervention. That's very important. And social assistance, minimum level, social benefits, according to us, should be extended to, to persons, particularly, women, families, of small means. And whilst acknowledging small coverage, commensurate with available resources, in social assistance, the country aims for some kind of universalization, and adequacy of social assistance in the long term to ensure that all in need of protection are sufficiently, covered. So the quest for universalism is, also widely supported and influenced by, our social protection, initiatives, in tune and in sync with the, the ILO social, protection floor initiative.
Alert, your internet connection is unstable.
It is vital to note that under social assistance, the government of Zimbabwe, has, really done a lot, and it has tried to guarantee, women, tried to guarantee people, in the informal sector, some income security and some kind of essential health care, to all of them, to women, older persons, and if other groups that cannot work, other groups that also are unable to earn sufficient incomes. So social assistance is particularly critical, when to offset, existing inequalities such as an equal pay for equal, work, with, our national development agenda that speaks to decent work, that aims also to eliminate, poverty. We, in this regard, have tried really to to
Uh,
assist our
hello, Doc.
women. Our studies evidence that women in Zimbabwe constitute 52% of informal, sector workers. And to that effect, we have, had interventions in the field of, social protection for people whose livelihood sources were disrupted by the containment measures put in place to curb the spread of the pandemic. So, sorry, I observed somebody wanted to say something.
Yeah, we wanted to say, I think you can wrap up in 2 minutes, Doc. Thank you.
Good, thank you very much. So government also put resources towards social protection mechanisms for people whose lives and livelihoods have been disrupted by the containment measures. And to that effect, all women who were in the informal sector, in which they comprise 52%, and were registered, as the informal, sector employees, were free to apply and were given, an amount, in excess of, 2 billion Zimbabwean dollars. And we continue on that path together with other stakeholders to ameliorate the lives, of our women, even in the area of gender-based violence that has been increased by, the containment measures. A lot of systems have been put in place to ensure that women are able to report, any, gender-based violence, matters perpetrated, on them. Our police, our judiciary, and our, counseling or support systems, are all in place. Last but not least, let me hasten to say that the department, the sections that I'm heading, social development and disability affairs, is part of what we call
Alert, your internet connection is unstable.
Critical staff. And because we're part of the critical staff, we will continue working 24/7 to make sure that we cover, the psychosocial, and economic needs of our vulnerable, people. Thank you very much.
Thank you so much, Dr. Edmos Mtetwa, for quite an elaborate, presentation of the work that your ministry is doing in terms of responding to the scourge of COVID-19, as it also impacts on women and also impacts on the achievement of the Sustainable Development Goals. I think you spoke very well in terms of the policy direction and the policy instruments that were put in place by the government of Zimbabwe under your ministry to make sure that at least you address the unique and the peculiar needs of women, women with disability, and also women because they constitute the greater part of the population. We want to thank you so much for your presentation, and we really want to thank you the efforts that you continue to make to ensure that as a country you respond adequately to the demands within the mandate of the ministry. So I think in the interest of time, I want to invite at this juncture Honorable Halif Salah, if he has managed to join us, to also come and give his keynote address for today's event. Honorable Halif Salah, has he managed to join so that at least he can deliver his intervention.
It is an honor to be part and parcel of this historic occasion. The world has been shaped by thinkers, inventors, and builders. And they do so to address the demand of necessity. We've always been told by the wisdom of the ages that necessity is the mother of invention. Challenges must always be seen not only as an adversity, but also an opportunity. COVID-19 must not be allowed to conquer humanity. That could only be prevented if we stand together to study the virus and its impact. Fundamentally, the virus is a killer, but a killer that has awakened in each human being in the world the awareness of the vulnerability of humankind as a whole. In the past, illnesses and ill health were seen to be attributes of developing countries. And many people in the North had always felt a distance from the adversities that had led to the destruction of many human beings in the world, such as national disaster and the rest. And they've always taken the posture of being civilians, rather than people who are duty-bound to give solidarity to their fellow human beings in the world. That created an environment of inequality and subservience. COVID-19 has told all of us that we are equal in this play. It came with a vengeance, not only on the South, but also on the North, acquainting all of us with the fundamental challenges of development. Human beings cannot exist on this earth in liberty and prosperity until we take charge of our destiny. That requires thinking, changing of mindset. It also requires changing instruments that we use to govern. Institutions that must arise out of those instruments, and culture that must be built as a way of life. Humankind has always translated information into knowledge and knowledge into culture, into the way of life. COVID-19 has told us that all the health systems in the world are weak, contrary to what we believed in the past. That each had to adjust to a new reality, convincing all to become more inward-looking than externally oriented. Borders were shut down, focus given to nations rather than the world. Those who were affected by the illness were isolated and quarantined. The culture of superiority and inferiority broke down, and human being reduced to its real nature, that we are all equal before the adversities of the world, and together we must work to overcome those adversities. Inside homes, in communities, everywhere, the culture of the superior became very evident, that it was just simply the foolhardiness of the human mind. Because those who believe that they should not shake hands with others because they were super. Families could not shake hands with each other. Friends could not shake hands with each other. Those who deemed themselves to be equal to each other could no longer take each other with their reverent eye to see themselves to be equal because they could share social relationships. Social bonds were torn apart, and we were all given the orientation that if we are to overcome the illness, we must wear face masks, which many would not want to do because it was the culture of some to put on certain face masks. It also told us that we should not shake hands when it was the culture of some that they should shake the hands of some but not others. So culture began to be transformed, requiring each of us to sit down and reflect again. And that is the purpose of this conference, the demand for each of us to sit down and look at ourselves, look at our societies, look at our world. That we must change as persons. We must change as countries. We must change as a world. COVID-19 is telling us that each country has the capacity to be self-reliant and capable of self-determined development. Because if we do not do that, a day will come when others will be so preoccupied with their own adversities that they will not have time for us. So the alarm bell has been rung. Each people must sit down and ask the fundamental question. With all the resources that we have, why is it impossible for each of us to build sovereign national wealth that will enable us to carry out the agrarian revolution, the green revolution, the industrial revolution, and the digital revolution, to be able to be at par with other people in the world? We have the resources. What we need is to eradicate the poverty of the mind, change the mindset, become thinkers, inventors, to be able to build a world of self-determined development, self-reliant development that will guarantee to our people the liberty, dignity, and prosperity they deserve. It is time to look internally at the internal contradictions. Patriarchy, which subjected women over the years to poverty and degradation, making them live under agrarian conditions where COVID-19 came with a vengeance, making it impossible for them to sell their crops as markets closed down because of the need for social distance. Shops were closed to prevent interaction between human beings. Markets were closed to prevent interaction. Goods were not sold.
Honorable, can you be also rounding up in the next 2 minutes? Thank you.
So in essence, then, those vulnerable women deserve not only social protection, but they need economic emancipation. We must rearrange our economic priorities. Similarly, the world that relied on tourism saw the devastation eradicating the tourism base. Companies that relied on their aircrafts became bankrupt. Unemployment increased in the developed countries, indicating that the old system of international economic relations, where they exploit the South to the advantage of the North is no longer sustainable. We must reinvent that international relation. Looking at the issue of caste, people being oppressed by virtue of descent and work, it is now very clear that social distance is now being managed as a result of COVID-19, showing that there is no difference between human beings. Fundamentally, my conclusion, the 21st century is a century for the transformation of the world, where all of us must become equal in sovereignty. Caste must disappear. Segregation must disappear. Discrimination must disappear. Each human being is sovereign, and all countries must recognize the sovereignty of all people. That is why we have the Republic. The Republic must become supreme in the 21st century, bringing about society where all are equal in sovereignty, each having the right to elect governments and each having the right to benefit from the sovereign wealth of all countries. That is the lesson we should draw from COVID-19. Thank you very much.
Thank you so much, Honorable Salah, for a thought-provoking and also passionate delivery that you've given us today. I think you've challenged us to say that we need to work so hard as nations so that we do not let COVID-19, to ravage humankind. I think you spoke about key issues that are now challenging even our institutional setups and also exposing even our health infrastructure, that they are not adequate to respond to the crisis of health of this nature. Thank you so much for quite an elaborate presentation, which managed to bring on the fore, I think, the key aspect that we need to take forward, I think, from this discussion, so that as the whole world, we are able to position ourselves to adequately respond to the issues that we may continue even to face even in the future. Thank you so much. So at this point in time, allow me, ladies and gentlemen, to thank our chief guest, Dr. Edmas Mtetwa, and also our keynote speaker, Honorable Salah, I think, for their elaborate, passionate, and thought-provoking presentation that they've given today. We really appreciate your time. We really appreciate your inputs. Continue with us because the discussion is still on. Let me invite Ingo just to give us a presentation in terms of the report, the global report on COVID-19 and its impact on women with the multiple discrimination. And Ingo, we are going to give you 5 minutes to ensure that you present a concise, information with regards what came out, your findings, key findings of the global report on the COVID-19 impact on women and with multiple discrimination. Over to you, Ingo. Thank you.
Yes, thank you, Leonard, and also thank you to the chief guest and the keynote speaker. You might think there's another man speaking. So we are going to release the Leave No Woman Behind report now, and we will have several women speaking afterwards on the content of the report, so I'm very grateful for this. Let me introduce to the report. We are at the high-level political forum, and the key principle of the Agenda 2030 is leave no one behind. So from this, we got the leave no woman behind, as gender equality is the central condition for achieving poverty eradication, but also the Agenda 2030 in general. But then there's a second sentence next to the leave no one behind, which is often forgotten, the furthest behind first, which is actually, I think, very logical. But unfortunately, it doesn't get that much attention. If we think about the furthest behind, then women facing multiple discriminations are definitely among the furthest behind. And we have started the Leave No Woman Behind project with women with disabilities in Africa because they were hardly represented in any processes, even not in civil society. So the basic idea and concept was to support the organizations to take part in political processes from the local to the national, to the regional and the global. And I'm very happy that this was successful, that several women came up and are much better represented now. And when the COVID crisis hit last year, then of course, women with disabilities, but also other women were quite strongly affected. And then we thought to prepare this global report of different groups of women. So let me just say, in general, we are talking not about a small number. We are talking about more than 1 billion people. If we think women with disabilities alone are already 600 million, of course, then there's an overlap with older women and many other groups. So we will hear. So I want to use this moment now to release a report where we have collected the voices of women's organizations from all over the world. So let me share my screen where we have the link to the sorry, I need to open this again. These are the small technical problems. So let me now share my screen. So it's not yet there. So here you get the report. So also, yeah, yes, I have the report here printed, but you can get it online. So the link will be posted in the chat. It's a 89 pages report. It became much longer than we thought, but we have a good summary at the beginning. And here you can see we have 4 key papers. So we have the overall overview on the impact of COVID-19 on women with multiple discrimination, written by Sylvia Bieles and George Gelber. So that's the first paper. Then the second paper on the status of women discriminated by work and descent was written by Lee McQueen and Bina Palikal from the National Campaign for Dalit Human Rights, and also from the Asia Dalit Rights Forum and the Global Forum of Communities Discriminated by Work and Descent. So most of the papers were basically written by these networks of women. Also the third paper on women with disabilities were mostly written based on the reports from 8 countries in Africa. So the Ghana Federation of Disability Organization, AMASPIF in Mali, the Polycom Development Project in Kenya, the SDGs Kenya Forum, and others contributed to it. And Sylvia Bieles and George Gelber brought it together into the report. And then we have the fourth one on the status of indigenous women in Asia, from the Asia Indigenous Peoples Forum and the Asia Indigenous Peoples Pact, not Forum, and the Network of Indigenous Women in Asia. So I like also to thank all of you that you contributed to this, and we will hear more about the concrete situation in the coming hour. Finally, I like also to thank my colleagues who have done great work. So Kieva Azamor is the project coordinator of the Leave No Woman Behind project. Then Pradeep Baisak, who coordinated the report, Johannes Butcher, who helped with the communication, and also Rajev Singh, who have helped with the layout. So you will have the opportunity to see the report. We will also publish then the individual reports separately in order to stress the different elements. And we will also have the final recommendations at the end. So the report is released. Thanks again to everybody, and let's listen to the different chapters now. Thank you.
Okay, thank you so much, Ingo, for giving us a presentation in terms of the report that we have officially, launched through this panel discussion and through this side event during the high-level political forum on the sidelines of the high-level political forum. Thank you so much for launching the report, and maybe to then get into detail. We would also want to appreciate how women and girls facing multiple discrimination are impacted by COVID-19. And to do that, we are going to call upon Sylvia Gilbert, who is also one of the authors of the Leave No One Behind report. And allow me to invite her, and we are giving her 5 minutes to then present the findings and also the information that they would want us to know. Over to you, Gilbert. Thank you.
Thank you very much. Can you hear me well? It's great to be here to follow such interesting presentations, and also to pick up on the point that Ingo made, that often we forget that leaving no one behind actually means making a real change in reaching the furthest first. And it's been great to work on this report, because we have been involved in looking at who are the furthest behind and what their issues are, but also what they're saying to make sure they're no longer the furthest behind. Because the greatest human rights violation is invisibility. And as we go through the report, we will see why patriarchy, stigma, and discrimination is at the root of invisibility and human rights violations. So I've got a presentation. I'll try and get through it quickly. So I'm going to share my screen. Hopefully this will work. Please tell me, everyone, if it does not. Okay. So just a little bit about myself. I'm part of a consultancy with George Gelber, and we work on issues of social inclusion and social exclusion, focusing on aging, disability, human rights, and those left behind in general. So to begin, I just wanted to show you these two quotes. One is by Dr. David Nabarro, who is very clear that COVID will only be defeated if we defeat disadvantage. COVID is a disease of poverty, powerlessness, inequities, and injustice, a disease of the disadvantaged. I'd like us to think about that as we go through the various presentations this morning, today, this afternoon. And the second quote is from the UN Secretary General, who is saying that the global vaccination campaign represents the greatest moral test of our times. We know that it's very unequal. Vaccination goes well in some countries, such as mine, the UK. In many other countries, it isn't going well, and 1% of people in the global south have vaccinations. This is absolutely wrong, and it must be corrected. So what are the impacts? Well, our research has shown, as we say in the report, that it is an X-ray of the inequalities which happen in the social, economic, and environmental sphere. But we don't know precisely about who and where are those likely to be infected and to die, because we lack data, we lack information. And the impact of curfews and lockdowns are kind of known, because we bring them, those of us who work with the left behind, to the policy arena, but actually, is that driving policy? So it was great to hear the input from Zimbabwe and Gambia on how we can correct this wrong. So we need to know who is being vaccinated, where and at what cost, and make sure that vaccinations are available to everybody without discrimination. We need to know more about long-term health impact, including isolation, particularly for women of older age who aren't allowed out and women with disabilities, bereavement, widows, and the impact of economic and food insecurity, and what is really going on with long-term unemployment and the failure to extend coverage on social protection. So it was great to hear the words of the minister on that from Zimbabwe. So we've looked in the report, as Ingo has said, on these older women and men, as you can see on the slide, disabilities, migrants, refugees, displaced persons, ethnic minorities, widows, informal workers, youth, and LGBTQI persons. We have seen how COVID has increased violence, poverty, exclusions, scapegoating, health problems, income and housing inequalities. We've looked particularly on migrants and refugees, often left out of the picture, despite the fact that the Global Compact of Refugees, agreed in 2018, is very clear, but currently 168 countries have fully or partially closed their borders, 90 making no exception for asylum. And the asylum seekers, including children, are being pushed back as we speak to countries of origin, stranded in prison-like centres. Many child refugees may never return to school. So what are the SDGs doing about this? What is the urgency? And to be the future of inclusion, as UNHCR is asking, let's remember that refugees and migrants want to be accepted, want to belong, want to work, even though they suffer discrimination horrendously. And these are some of the findings from the work with women and girls with disabilities, but I won't go into this because we have another speaker on it. But I think a real issue is poor data, the problem of political participation, which is constrained by cost and infrastructure and attitude, and this persistent violence perpetrated by those closest. So what are the challenges exposed by COVID relating to the SDGs are some, as you can see here. They've been talked about in the high-level political forum this week endlessly, but as far as I can see, not much is happening concretely to deal with it. So social protection is a key problem. Only 40% of the world is not covered, and they're mostly in the least behind groups. This is unacceptable, and there are proposals such as a global fund for social protection, which need more support. Financing for developing countries, data gaps and partnerships for change are very behind. And in terms of chronic hunger and food security and poverty, the figures are higher than they were in 2013. So we have a lot to do on that. And this is a very busy slide, but it's actually contained in a report that GCAP was involved with, and I and my partner, George Gelber, too, last year, looking at the impacts of COVID. And it's a useful one to sort of see, but I can't really go into it because of time. But we do have some, we came up with some conclusions that actually COVID is not an excuse for inaction, but the very reason to accelerate efforts. But these words, ambition, urgency, and scale, are very important. We mustn't forget climate change and inequality. we think that global citizenship is the way forward with political will, and that taxation, obligation, solidarity, and inclusive data are the bedrock to ensure our human rights to social protection, vaccines, universal health, social care, lifelong education, inclusive employment, decent housing and wash, justice, and decent humanitarian responses. So this is my final slide. We have a choice. The choice is ours. We are global citizens. We must make sure our governments do the right thing. Thank you. That's it. Thank you very much.
Thank you very much, Sylvia, for quite an elaborate presentation. I think you managed to highlight the key, issues that emerged from the work that you did. Very excellent work. I think the revelation that you are bringing up is something that we need to continue having a conversation as we move on, because I think you managed to talk about the key issues that exposes how women and girls are also further marginalized, by the issue of COVID-19. No, thank you so much for your presentation. I think for more information, we want to thank Sylvia. She is a seasoned activist, having strong professional and demonstrated history of working successfully to build strategic alliances in civic and social organizations. With 35 years of policy analysis and research experience in aging, social policy, social protection, gender and inclusion, civil society, and human rights. We want to thank you. You have quite a lot of wealth of information that we need to continue, learning from you. We thank you for your presentation. Now, at this point in time, allow me, ladies and gentlemen, to also invite Nina Okora from Ghana, Federation of Disability Organizations. She's going also to give us a presentation on COVID-19 and women with disability in Africa. So Nina is a Ghanaian working closely with Ghanaian Federation of Disability Organization as a member of the Ghana Blind Union. She is a professional social worker with the Department of Social Welfare, Ministry of Gender, Children, and Social Protection. Nina is a member of the Board of Directors of Africa Union of the Blind in Kenya, representing the youth. She is an ardent follower of the disability movement in Ghana and in Africa at large. So in this regard, allow me, ladies and gentlemen, to invite Nina to also give us here a presentation. Over to you, Nina.
Hello, everyone. Can you hear me?
Yes, we can hear you. You can proceed.
Thank you very much. So good day to everyone. I trust we're enjoying the illuminating speeches so far. I know I am one of the panelists and persons with disability, woman with disability, but I already feel empowered by the speeches that has gone on so far. So I want to say a very big thank you for inviting me to speak on COVID-19 and women with disabilities in Africa. My introduction was drawn from a UN policy brief meeting on women's basic needs during COVID-19, and I will read quite a bit of it. It talks about the global pandemic I'll take that again. So the global crisis that has resulted from the spread of COVID-19 is deepening pre-existing inequalities and exposing cracks in our social, economic, political, and health systems. Women and girls with disabilities experience multiple and intersecting forms of discrimination and exclusion, which has an impact on their ability to meet basic needs, even in normal times. I would not overemphasize this point because we have all come to see that COVID-19 really has exposed all the social injustices, the ones we face in education, healthcare, employment, social life, and everything else in between. So the outline of my presentation is going to take this form. I'm going to talk on access to information on the global pandemic. I also talk on employment, education, and income levels for persons, women with disabilities during the COVID period. Limited access to formal and informal support services. There was also slow response of national agencies to the calls of DPOs. And finally, I will come in with some recommendations. Okay, so starting with access to information. Information was very slow. Share of information was very slow, mainly because, of course, everyone says that we are not in normal times. So we can't say that there was already information put down. We needed serious information to know how the pandemic worked, how the means of transmission, and how to protect ourselves. So some of the reasons why this information was slow in reaching persons with disabilities and women in disabilities specifically has to do first with, one, limited access to information resources. We all know that there is a real cycle of poverty among women and women with disabilities. Most of them hardly have access to a radio. For us, our case in Africa, we learn more of information from our radios or from TVs, from billboards, and more recently from social media. Very few women with disabilities can access this information. Some of this information were also presented in infographics, which will be very normal for most of you on this panel or as participants to this show, because you will see a picture that illustrates everything, how to wash your hand, how to put on your nose mask. But my question here is, for a blind woman like me, how do I access such information on an infographic? Again, for women with disabilities, especially those with hearing impairments, information was very slow in reaching them because apart from reading these infographics and listening to what we have on the radio and watching what we have on the TV, there was very little sign language interpretation. So deaf women or women with hearing impairment were very slow on catching on to what was going on. Most will say, I've heard there is an illness, but I really don't know what it's all about. Now, moving on to education, employment, and income. Studies show that women with disabilities are less likely to access formal education and formal means of employment compared to other people, men with disabilities and others. The consequence is that women with disabilities are not able to use ICT tools to first access education and work in a formal environment. Now, this exposes them to a lot of abuse because then they have to access the possibilities of working in the vocational space or the informal space. This means that all these systemic barriers are real true. They are real and existing, because then I can't use normal means of teaching and learning, normal means of going to work and participating in my office. Consequently, these women are left to the mercies of their families and friends, which further exposes them to abuse and harm. For instance, if a woman with physical disabilities cannot go out there, go to work, cannot make her handicrafts and sell, she needs to stay home and wait for someone in the house to give her food to eat. Now, what if this person does not feel like doing it, or is tired, or is stricken with COVID? How does the woman with a physical disability get to eat? There has also been limited access to formal and informal support services. As we all know, persons with disabilities or women with disabilities need these support services to go about their daily lives, to live independently and access social services. A blind person will need someone to help her go around, catch a bus, go to the market, buy groceries. A person with hearing impairment will need someone to help him or her speak in a sign language or interpret what they're saying to others. So will others with varying form of physical disabilities need specialized care, like taking their baths and feeding them and doing their laundry. All these issues were quite limited because most of the preachings that were going around in the pandemic were stay home, stay safe, wear your mask, socially distance, and all that. It was so depressing for a lot of people. I am an example. Now, there has been very, very slow response of national agencies to the calls of DPOs to include persons with disabilities and women with disabilities in their stimulus packages and preventive measures or mitigating measures. So, for example, a lot of government agencies were going around sharing food, or they'll gather at a vantage point where there are so many people and begin to share food. When will a person in a wheelchair get to the point to make sure he or she gets that food? How quickly will a woman with hearing impairment hear this information? And how will a blind person who will need a sighted guide be able to maneuver her way through all these crowds? And trust me, it was so much of a mob to get through, to get food to eat during the pandemic. In Ghana,
Nina,
for instance, yes, sir.
Nina, yeah,
Yes,
you should
sir.
be rounding up in the next 2 minutes.
Great. So in Ghana, the Ghana Federation for Persons with Disabilities call to stakeholders to implement some of these policies in a specialized way, such that women and persons with disabilities will be able to access them. But the response was very, very, very slow. In conclusion, I'd like to make the following recommendations. That first, states, parties, and DPOs step up their game in training women with disabilities on how to use ICT tools and be competitive. Stakeholders and other DPOs should also be actively involved in promoting special education so that women with disabilities will be able to be employable. All right. There are so many other recommendations I make here, but the one I like the most is that state parties and DPOs should involve leaders of women in disability in their intervention measures. This way, their voice will also be heard. After all, the saying goes, nothing about us without us. Thank you very much.
Thank you so much, Nina, for a profound, presentation in elaboration of the unique, challenges that women with disabilities are facing during this time of COVID. And indeed, you managed to flag out the practical challenges that women with disabilities were facing, and also to proffer, critical recommendation that needs to be considered and taken on board by policymakers to respond and also ameliorate the lives of women with disabilities. Thank you so much for that. Let us move on with the program, and this point in time, we want to receive a presentation that is going to touch on the challenges for indigenous women in Asia amidst COVID-19. And to do that, we are going to be inviting KK Tolentino Asia Indigenous Peoples Pact network of indigenous women in Asia, who is going to speak for also about 5 minutes. So KK, an indigenous Domagat women of the Sierra Madre Mountain range in Luzon Island in the Philippines. She is the national coordinator of Indigenous Women's Network in the Philippines. She's also the steering committee member of the Network of Indigenous Women in Asia and the representative of AIPP on this event. So at this point in time, allow me, ladies and gentlemen, to invite KK to also give a submission. Over to you.
Hello, everyone. Good morning, good afternoon, good evening. On this event, I will share the challenges for indigenous women in Asia amidst COVID-19. NIWA at a glance. NIWA, established in 2019, is a member-based network covering 14 Asian countries. It envisions that indigenous women are empowered, capable, and self-reliant, fully enjoying their rights, fostering inclusive and sustainable development in Asia. Recently, NIWA presented its written submissions to CEDAW committee and has also developed global report on Leave No Women Behind with GCAP Global. The impact of COVID-19 on indigenous women in Asia. COVID-19 has had disproportionate impact on indigenous peoples, especially indigenous women and indigenous people with disabilities. It has further exacerbated the existing inequalities for indigenous peoples. Pandemic is used as a shield by many ASEAN governments to violate the rights of indigenous peoples towards their land, territories, and resources. COVID-19 escalating economic burden. Indigenous women who are dominant on the informal sector face worse situation with lost employment, followed by tortures by house owners in the cities. In Bangladesh, indigenous women who are largely engaged in beauty parlors and garment industries lost their employment and faced economic hardship. In Thailand, Sian indigenous women laborers were not picked up for the work due to a preference for male counterparts during lockdown. As per studies, the percentage of indigenous women working in informal sectors is 26.5%, higher than non-indigenous women. Indigenous women and children without the legal documentation were deprived of access to basic services and relief packages during pandemic. In the Philippines, some indigenous women and young mothers would not receive local relief initiative as they were not listed on census list. In Thailand, indigenous women living outside town could not access relief packages. COVID-19 rising cases violence against indigenous women. Violence in different forms against indigenous women have doubled during lockdown. It intensified stigmatization and discrimination towards indigenous communities of Northeast India for their Mongoloid feature. Continuation of military operation and development projects in some ASEAN countries have increased cases of sexual assaults, rapes, and harassment. human rights violation during COVID-19. A study of Business and Human Rights Center has shown that from March to September 2020, on average, one defender was attacked, where 1/4 of attacks were against women. In Philippines, numerous cases surfaced where indigenous women and their organization have been harassed, interrogated, red tagged, vilified, and intimidated. Now, we in Network of Indigenous Women in Asia, we have this recommendation. Ensure the recognition of indigenous peoples and their collective rights and self-determination. Ensure equal access of health services, social protection, COVID-19 vaccines, and relief support. Institutionalize free prior informed consent to protect collective rights and ways of life of indigenous peoples and indigenous women and retain its applicability during the pandemic. Provide special protection measures to indigenous women and girls in conflict and militarized regions. Collect disaggregated data on the impact of COVID-19 to reflect on situation of indigenous women and girls. Minimize the human rights violation against indigenous women and indigenous women human rights defender. So, friends, all of these my sharing. Thank you.
Thank you so much, KK, for your presentation. I think you managed to present, the issues that are compounded by COVID-19, especially on the indigenous women. So at this point in time, ladies and gentlemen, in the interest of time, allow me to also call upon a presentation that is going to be delivered by Bena Palico, Global Forum on DWD, who is going to give us a presentation on the impact of COVID-19 on the communities discriminated based on work and descent. And Bena is currently the General Secretary of Dalit Adak Andolin and Executive Director, South Asia Dalit Women's Economic Empowerment Program of Asia, Dalit Rights Forum. She has been immensely contributing to the NCDHR for the last 10 years, working on the Dalit economic rights, which with a special focus on Dalit women's economic rights. So we are going to give you exactly
आर्थिक अधिकारों पे खास तौर पे वो ध्यान देती हैं, तो हम उनसे 5 मिनट में अपनी बात कहने का अनुरोध करेंगे ताकि अब जितने भी हमारी
Thank you very much, Leonard, and salam, Jai Bhim, hello to everyone. I think it's great to be here. Thank you to GCAP for this opportunity and looking at Leave No Women Behind. In 2015, when the Agenda 2030 was signed by all the countries, one of the main focus areas was Leave No One Behind. Here we are, almost after 6 years of the agenda being signed and endorsed, that we're still asking the same questions that we asked when the MDGs were finished and the SDGs were started. I hope we don't spend another 10 years talking about the same issues. So this very consultation is very relevant to that. We all know that COVID-19 pandemic has had huge impact on both the economic and social spheres. Whilst research and analysis are focusing on the global economic losses in a bigger way and the challenges ahead of the governments and policymakers, it's important to throw light on the plight of the poorest as most marginalized people, which are the communities discriminated by work and descent, like Dalits in South Asia, people of slavery descent in the Africas. In most cases, gender discrimination intersects within the community is discriminated by work and descent, putting women in a most disadvantageous and vulnerable position. For example, in Bangladesh, Dalit girls and women often fall prey to prostitution and trafficking of bonded labor. Despite the pre-existing vulnerabilities, the government did not announce any special or additional measures for the women. As per the International Federation of Human Rights, there was a rise in rapes against women and children during the COVID-19 pandemic in Bangladesh. In India, in the south of India, in a city called Vijayawada, a 9-month pregnant Dalit woman who had to descend 250 steps from a hilltop home to get daily essentials was sent back empty-handed for being a Dalit. A domestic worker in Uttar Pradesh, which is the north of India, was repeatedly beaten up for raising her voice against the denial of food supplies. Several instances of gang rape were reported across the country. In a gruesome case, a Dalit young woman was kept hostage by 5 influential people of a village for 8 hours on a wedding day and gang rape. I can go on and on. I think many of us also must have heard of the Hathras case, which was a case of rape, gang raped and murdered by the dominant caste in India. The National Campaign on Dalit Human Rights, the National Dalit Watch, through their findings have found that 65% of single women-headed households were not registered under the scheme or the public entitlement, which was for free testing and treatment for COVID-19. Likewise, 68% of single women did not get the scheme for free gas refill for 3 months. 59% of single women households were not registered under the flagship rural employment scheme. These are huge numbers, my friends. As compared to the general population, we can see that there is a much higher percentage of Dalit women who do not have access to these. In Nepal, for instance, assessment conducted by the feminist Dalit organization revealed that most of the Dalit women have no source of income and were facing problems due to food scarcity. The relief packages could not easily reach the communities. In Pakistan, there was increased violence against women and girls across 25 states of Pakistan during the peak COVID-19 pandemic between January and December 2020, with 57% of the total cases of violence was reported from Punjab alone, which is a highly Dalit populated. Sri Lanka, similarly, plantation workers, almost 80% of the workers are women. Yes, I'll conclude with just recommendations. Thank you. Just two things. And the same situation of vulnerability and equality affecting Roma women in Europe can also be seen. Quick recommendations: universal and inclusive coverage of all Dalits and people discriminated by work and descent under existing national security schemes, economic packages, both in cash and in kind assistance to these communities, social security measures. I think that's something that we've all been demanding, access to healthcare support and insurance, and we must have disaggregated data on women within that disabilities, within these communities. And of course, as we are all talking about vaccination and universal vaccination program, specifically for women from the marginalized communities. Thank you very much, Leonard. And
Thank you so much, Benna, for an elaborate presentation. I think you managed to flag the key points that are exposing the impact of COVID-19 and how it is also contributing toward the discrimination of women based on work and descent. Thank you so much. So at this point in time, I want to invite Veronica Serafin Latindan to also give a presentation in the next 5 minutes. She's going to look at condition of women with multiple discrimination in Latin America. 5 minutes, if you can do it before 5 minutes, I think it's also going to be excellent. Over to you.
Buenos
Thank you,
días,
Veronica.
desde América Latina. Voy a hablar en español.
Good morning from Latin America.
Just a moment. If you can't listen to Spanish, then you need to put English in the interpretation at the left right corner on the bottom. Yeah, so please put English if you don't know Spanish. Thank you.
Sí, bueno,
अगर आपको स्पेनिश नहीं आती है तो आप इंग्लिश का चुनाव कर सकते हैं, तब आप ये स्पेनिश में जो बोल रहे हैं वो इंग्लिश में सुन पाएंगे, जिनको हिंदी में सुनना है वो हिंदी में ही हिंदी चैनल की रहे। लतीनी अमेरिका में कोरोना की
And this was noticed mostly on women. Latin America is one of the most unequal societies, economically wise, and this turns into inequalities for women. All this adds up. And in Latin America, there are different types of women. There's no one type of Latin American woman. There are farmer women, there are indigenous women, black women, white women, women who went to university and women who didn't, women who couldn't complete the studies. And while living discrimination, we see discrimination on women who we might regard as equal. I'll give you an example. Latin America has advanced in terms of education. We have managed to close the gap in terms of economy and education if we compare it to men. And also we've managed to tackle unpaid work. But this pandemic just made all these issues more evident. We saw all the different types of discrimination. And what we're doing today is how to go back to normal. We know that women had a disadvantage with regards to men and other women. So we need to have a discussion about how to not leave women behind, but at the same time, we need to ensure that there is a radical change. We know that Latin America had a period of economic success, and this was thanks to exports, which didn't have a very important added value. And as a consequence of this, women were working in precarious conditions. They were not paid even though they were working, and with a very low income. Therefore, we have to look forward and we have to make sure that we have structural changes on the Latin American economic model, because this economic model didn't improve the situation of women. It improved a little bit, but not enough, not what we needed. And despite this economic growth, we couldn't tax this, and we couldn't finance all the public policies in order to reduce inequalities, in order to finance mechanisms that would fight off discrimination, and in order to guarantee the well-being of women. That's why we need to think of the post-COVID recovery. But as we do that, we need to ask ourselves something, and we need to question ourselves. We have to think about what we were doing before COVID. We had an economic model that officially was successful in terms of economic growth. However,
Yes,
it wasn't
Veronica.
enough.
Yeah, you
We
should round
couldn't
up in the next.
put an end to inequalities, and we could not erase all these problems that we're living in this Latin American society and that give women a disadvantage. That's why we need to think of new policies, but also but also we need to think more critically from a feminist perspective. We know that we have these analytics, and we know that economic growth is not enough, GDP growth is not enough, reducing poverty is not enough, neither is employment. We need quality employment, we need salary and income equality, we need better conditions, we need to reduce workload.
Hello, Veronica.
There are aspects,
económica, la violencia física.
and we have physical violence, political violence, and as a consequence, Latin American women are not represented economically. There is a high level of discrimination. That means that women cannot be discussed in the political agenda.
Veronica, you should be concluding.
Económicos y políticos que
So
no
we need to discuss all the social factors which don't allow us to put an end to discrimination and that don't allow us to reach equality. And we need to take into consideration all the different types of women that we have in Latin America. So that's the current discussion. I would like to thank you for this opportunity. I would like to thank you for being part of this debate, for letting me share the situation in Latin America and participating in this forum, and allowing me as well to learn about different regions. And we understand that despite all our differences, we are united by this idea of improving the position of women in the world. Thank you very much.
Thank you so much, Veronica, for your presentation. I think you managed to flag out the critical issues that women are not a homogeneous group, and the implications of COVID-19 are also different with regards the structures, the demographics within the women. Thank you so much. So allow me again to invite Zia Uri Rem to give us a presentation on condition of women-headed households during the pandemic in Pakistan. So we want to give you 5 minutes to make your intervention. Thank you.
Thank you very much indeed for inviting me for this very important discussion. I've been sharing the PPTs out of one important report that was published almost 8 months before and after 12 months of the COVID-19 pandemic in Pakistan. So those who will not have that much of detail through my presentation can get access to that link. I've already shared that link with you all. The purpose of this assessment was to collect basic primary data on some of the basic indicators, included information related to the SAS Cash Grant Program, which was launched by the Prime Minister of Pakistan to facilitate and the poor community, particularly woman-headed families, transgender communities, people living with disabilities, religious minorities, and so on and so forth. Through this assessment, we actually also tried to learn about the hardships of the vulnerable groups, whether they know about the coronavirus, the economic challenges, the status of behavioral changes, inclusion of most vulnerable groups of our society if in the mainstream activities, and if the elected representatives have ever done any support to them. The assessment was conducted across the country following these 4 categories: woman-headed families, persons living with disabilities, religious minorities, and transgender communities. And a huge number of people, like 3,997 people were contacted for this survey. So according to the survey, more than 90% women-headed families, 93% people living with disabilities, 91% religious minorities, and 89% transgender. Out of the total respondents, they were saying that they shared that they were aware of the government schemes and the other relief programs. 97% participants comprised on all 4 categories shared that they deserve to be part of this program. But interestingly, only 27% people got this support from the government. I'm going through this quickly because I've been allotted 5 minutes. So out of these 27% people, 57.4% women-headed families, 78.07% people living with disabilities, 77% religious minorities, and 93% transgender communities. They registered themselves in the government scheme through mobile. Out of all these 4 categories, 91% respondents expressed that they received complete amount of 12,000 Pakistani rupees, which is around $80 for 3 months. But 32.97% respondents were happy from the cash amount. The rest of the people were not happy because this amount was very little amount. Out of all 4 categories across 44 districts, 31.7% respondents shared that they have received relief packages from other relief programs other than the government programs. And out of 100%, 51.7% responded expressed that they came to know about other relief programs from their friends and communities. 94% women-headed families, 96% PWDs, 97% religious minorities, and 94% transgender communities were aware of coronavirus. In total, all of these 4 categories, 78% people were having an understanding about coronavirus spread through, shake hands, hugging, eating, offering prayers, etc. And 70% of the respondents were saying that yes, coronavirus is a death-taking disease. 55.04% respondents choose the correct option of 14 days quarantine. Women-headed families had at least a percentage of choosing correct option, like 46.13% women-headed families chose this 14 days quarantine. The rest has been also mentioned. Interestingly, out of all of these 4 categories, more than 90% of all these categories were saying that they faced severe economic changes at family level due to coronavirus. From all 4 categories, 65% respondents stated that they are facing economic distress, less income, whereas 53% shared that they became unemployed due to the economic situation during the COVID-19 in Pakistan. Some of the key findings were that only 36.5% respondents were satisfactory due to the health services being provided by the government. The rest, the huge number of people were not satisfactory in the health sector. Situation of the education during the COVID-19, 87.7% respondents think that the education of their children is badly affected by coronavirus. Women-headed families were found most concerned about their children education, with like more than 90% women-headed families were concerned about that. 99%, various, provinces data is also available. 23.8% And 20.37 respondents agreed that digital measures, because the government also introduced the digital measures to reach out to the students, but the parents were saying, like 20% parents were saying that digital measures of the government taken for the education are effective. 80% people were not satisfied with that. State of, while we talk about state of mental health during COVID-19, 81.7% respondents agreed that
Yes, you should be rounding up. You should be rounding up.
Okay. So 81% people were like facing mental health issues. Violence and discrimination during COVID, 56 point, as Bina already mentioned this, 56.67% people, like woman-headed families, passed through severe psychological, physical, verbal, and misbehave during the COVID-19. 33.7% respondents from transgender community faced abuse. 55.92% people living with physical disabilities, they also face the challenges. 41.7% people living with disabilities and 55.92% religious minorities face challenges. 26.72 respondents of the category religious minority shared that they have faced discrimination during COVID period. Out of that, not being included into relief packages, because it was said that the relief packages should only be given to the Muslim community, instead the religious minorities. So they faced a lots of discrimination over here. Only 19% people were satisfied by the role played by the elected representative during this whole pandemic period. During that survey, the people were not satisfied by the role of the elected representatives. There are certain suggestions, like special facilitation should be provided to the transgender community, religious minorities, and woman-headed families to provide proper. For example, assigning proper information desks, making separate queues, so and so forth. Special enabling distance assistance should be provided to PWDs and elderly people in terms of making proper waiting areas and needful arrangements like availability of wheelchairs, ramps, etc. Government and civil society should run regular behavior change campaign for minimizing people's insensitivity towards the transgender community, PWDs, religious minorities, etc. Government should ensure accessibility of technology to make people more tech-friendly to overcome socioeconomic barriers during this pandemic. And there are so many other recommendations. Thank you for giving this time.
Thank you so much for an elaborate presentation. I know we had to cut you because of time, but I think key issues were emerging from your presentation. I think would continue to encourage us to also read through, I think, the elaborate presentation as you are as all the presentations are going to be shared. Thank you so much for the issues that you managed to flag out in your presentation. So last but not least, allow me, ladies and gentlemen, to invite Masaki Inaba, who is going to give us a presentation on the impact of COVID-19 pandemic on the health of marginalized women in Japan. And likewise, we are going to give you exactly 5 minutes to give your intervention. Over to you, Masaki.
Okay, and thank you very much. And can you see the slide?
Yes, we can see. You can proceed.
Thank you very much. It is a little confusing. Please wait for a moment. Now, let's say, how can I do it? Okay. I will explain the precondition of the gender gap in Japan first. Before the COVID-19, and there has been the very significant gender gap between men and women on the situation of the employment and the wages. So you can see that the firstly, the low participation of women for economy and politics, and also the rate number of non-regular employment. Women, it has been increasing, and also that how to say the non-regular employment is that the far bigger in female compared to male, and also the wages. You can see that the wages of the women is far lower than men. So this is the situation, current condition of the gender gap in Japan. And after that, COVID-19 made a significant and also the unproportionally impact for women and rather than men. So that one is that the suicide rate, number of suicides. So that women, we see the significant rise of the cases of suicides, and also the number of consultation of the gender-based violence. You can see that how to say increase very much and increase the gender by the consultation about the gender-based violence targeting the women. So this is the a very much significant severe situation for women in Japan, and also unemployment and so lower wages has a significant problems for women and compared to men. So Japanese civil society has been working to how to say the for the solidarity and the survival of these kind of women with diverse vulnerabilities. And for example, one case is the consultation for women by women, and it was held in March 14 and 15. And also second consultation will be held tomorrow and the day after tomorrow. So it is a comprehensive counseling sessions for women suffering from unemployment, impoverishment, mental illness, isolation, and loneliness and abuse. So these kind of results of the consultation has been used to advocacy. And this photo is that how to say the meeting of the steering committee of the consultation to the governor, Tokyo governor Yuriko Koike, and this kind of advocacy has been done. So the situation has been improved by these kind of civil society efforts, and especially led by the women groups. So this is my presentation.
Yeah, we should be ending.
Yeah. Yes. So this is a summary of my presentation.
Wow, okay. Thank you so much. Thank you so much. Ladies and gentlemen, I want to take this opportunity to thank you in a huge way for the presentation that we got, and also a lot of activities happening even on the chat platform. I see that there is a more engagement in terms of suggestions, appreciation, and recommendation that were also coming. I think maybe at this point in time, allow me to invite Pradeep as we come to the conclusion of our meeting. I understand that I think we have stayed quite a long time. I think the presentation was so much, loaded. So Pradeep, over to you. Thank you.
Can we take one or two questions? We actually do not have time. We're already consumed more time than allocated. Maybe 1 and 2 questions, if you can, if somebody can raise hands. Very brief, and okay, panelists can answer in very brief.
Excellent. It's okay. So do you have any burning questions? We can take 2. You can even share them right away on the chat platform, or show by raising of your hands. Then we invite you to make your intervention. Only 2 questions. Or maybe you can just unmute yourself, then you come on the platform.
No, you can raise hands so that we can unmute you. Or you can place your question in the chat. We'll share all the presentation and links by email to all of you. That won't be a concern. Leonard, if colleagues do not have any question, then we can actually go and wind up.
Can I say something just right at the end? Because I saw a question in the question and answer thing about data. And I think what we've seen here, these how important it is to anchor policy in knowledge, and data can be collected from people. You know, it doesn't have to be rocket science, as we have seen, and without the data, we don't know what we're doing. So I know I bang on about this a lot, but there's a particular part of Goal 17, which is about data which has to be disaggregated by age, gender, disability, location, sexual orientation, ethnicity, etc. And it's really important that we all support that. And I think this event has shown how we can do that by collaborating through the GCAP and all this amazing work coming from the women who are the furthest behind. So I just want to reinforce that message. Thank you.
Thank you so much for bringing that on the floor. I think, ladies and gentlemen, it is now my singular honor to thank all our presenters on the panel, to start with the chief guest, Dr. Edmos Mtetwa, who is the Chief Director in the Ministry of Public Service, Labor and Social Welfare, who made a presentation on behalf of the government of Zimbabwe. Let me also acknowledge our keynote speaker, Honorable Salah, who also made interventions today, and also all our panelists who spoke through the key aspect that emerged from the global report that was done through the facilitation of GCAP and all other partners. It has been quite a live session with presentations that were done, I think, which managed to expose the key issues that we need to consider as we respond to COVID-19 going forward. I think in the interest of time, all the participants that have managed to log in, I want to thank you so much in a big way. You have made this important side event very successful. Even to the funders of this platform who managed to support us, we also want to take this time to thank you, and we wish you continue to support us as we continue to work together at a global level to address the issues of poverty, to address the issues of inequalities, so that we build back better and ensure that we lay a solid foundation of attaining the Sustainable Development Goals. Thank you so much, ladies and gentlemen. The meeting is adjourned.